another case. Rick Pescatore, he's going to give me a case.
So we're going to talk about a fun case. I don't know how stumpy it is, but we have a visual aid. It's an EKG, but I think it's a case that kind of is a good descriptor of what we do in the emergency department, how what we do touches all fields, and what I think what we do is important. This was, I really enjoyed it. It was a 28-year-old female who came into the emergency department with a pre-syncopal complaint. There's really no mystery there. What was most interesting, this is her 4th emergency visit in 2 months for the same complaint.
Always a red flag.
Always a red flag. Either they're crazy or something's really wrong, right? It's either I can write them off or I really have to pay attention. And you're right, if they're crazy, should be a peripheral consideration.
Yes, exactly. Always
it had been like some pre-syncopal complaints, but also some syncopal complaints. And this time it was pre-syncope, but as we've learned, is that all exists on a spectrum. And that's where we can start. Hemodynamically normal, sitting there in bed, I almost passed out.
Okay, so I'd like to know, what were you doing when you felt this? Can you describe that feeling of almost passing out?
Absolutely, I think that's a really important question. She was just sort of sitting at the table, no exertional component here, right? She was playing cards, eating dinner, nothing significant, and got lightheaded, got some tunnel vision, and almost completely went down. She said, it was very much like it's happened before, but this time, fortunately, I didn't pass out all the way. I wasn't even going to come because I didn't pass out all the way, but, my mother said I should come get checked out.
So, a couple of questions. Any chest pain, any palpitations, any headache, any
all, I think, very important questions. So no chest pain, none at all. Never have had any chest pain. But it's funny you mention it. Every once in a while, I do feel like I get some palpitations. I'm not really sure if it was associated with this, me almost passing out episode. And no headache whatsoever.
So did you happen to feel your pulse during this?
I actually did a quick EKG. No. I was wearing my Holter monitor. I didn't take any of my own vitals during my syncopal episode, no.
Okay, but you didn't feel like as if your heart was really racing as if you were out jogging. Okay. So then, tell me about your past medical history. Do you have any heart issues, lung issues, anything else?
Another great question, of course. I have no medical problems. I have been having this trouble where I seem to pass out every once in a while or almost pass out, whatever it may be. I know what you're going to go with next is like my family history here.
Exactly.
That's what I'm kind of concerned about. I have a strong family cardiac history. My 30-year-old cousin had a massive heart attack and died. And my 40-year-old brother crashed his car all alone while he was driving, crashed car, single car accident, and he died.
I see. What about your any medications that you're taking?
No medications.
Okay.
None.
What about caffeine intake?
Personally, the patient said no strong caffeine intake, nothing crazy there.
Alcohol, drugs, any of those things?
She likes small batch bourbons, but outside of that, that's me. Sorry. She's not a drinker. Totally normal patient.
Okay, all right. So, how about you're 28? Is that right? When was your last period?
When was your last period? Yes, Rick. I feel like you're always on your period.
Whatever is normal. 3 weeks ago.
All right. Surgical history.
So, no surgical history. Yeah.
Monitor. We'll take a look at that, and we'll get your lab, EKG, chest X-ray. What do I see on the EKG?
So here we have the EKG here, and it has some scribble that has remarked. So it kind of gives it away a little bit here.
Scribble.
We have some scribbles in lead V2.
All right. So
it's been de-identified.
I see a right bundle branch block, and I see I cannot read.
Sorry. It's bad scribble. That's the most important. So what I can describe this EKG here, because we are podcasting at the same time. Nothing better than a visual aid in a podcast, of course. So we do have that RSR prime appearance, right? But interestingly, it wouldn't, and there's no way to know this without pulling out your calipers, it wouldn't qualify as a right bundle branch block. Our QRS duration is 98 milliseconds, right? Relatively short. Yeah, it's actually relatively short, but we have that RSR prime phenomenon as well as an inverted T wave in leads V1 and V2. And then I think we can describe this RSR prime phenomenon interestingly as almost a coved ST segment downwards. And yeah, that's what we have here. Yeah. Coved ST segment. And here's the thing, this EKG is certainly not something that blows your socks off. But like you said, we have that right bundle branch pattern, which in the setting of syncope, I think, drives a couple considerations for all of us. And you had asked one of them earlier, the shortness of breath and chest pain. One thing we've learned recently with the PESA trial, and thinking about PE and syncope is always important. But this is a EKG that was missed clearly several times on presentation of part, and this is a type 2 Brugada.
Right, exactly.
Not the easier Brugada to diagnose. This one's a little trickier. But one of the things that's really important is that you mentioned that right front of the lens pattern, which I think is important. Anytime you see that pattern, I like to draw my beta angle. And this is something that I like to discuss with my residents. This is a simple thing we can do. We can find those kind of not obvious Brugadas, and we draw our beta angle. So what we do is we find our RSR prime pattern, we continue that ST downsloping, and we come back 5 millimeters downward on our prime segment, and we draw a triangle. If the base of that triangle is greater than, some people say 2.5, some people say 3 millimeters, that's a beta angle greater than 2.5 millimeters, which is suggestive of type 2 Brugada syndrome, and obviously something important in this patient.
So I missed something. Is she? Is this patient a young Asian male?
She is not. She is not. She is not a young Asian male.
These Brugadas are seen on the young Asian male.
Generally, absolutely. Yep. But they can span the globe,
Obviously,
as we've learned everything.
So I learned something about that. Then
this is great. So I'll tell you, this is, we do this podcast, and this podcast sort of falls into the foam world here. Yeah. And this is something that really was popularized through the foam movement as well. This was via the Steve Smith EKG blog, which I think we can all agree is a fantastic educational resource. And looking for that beta angle in an RSR prime pattern, I think, is super important. This patient went on to EP, got provoked, did develop a ventricular tachycardia, and now has a shiny new AICD.
AICD, that's great.
Yeah.
That's a great case.
This was a fun case.
It could be missed easily.
Yeah. Fortunately, she had no bad outcome from her previous visits, and this is why we do what we do. This kind of thing.
Totally. That's a really terrific case with subtle findings. Hope everybody enjoyed this case and hope you learned something.
Yeah.